Hi, I'm Natara Sims, and we'll be discussing the Deal versus Kearney case. And a quick summary to this case was our plaintiff, Mr. Kearney, was sent to the emergency room in Alaska after suffering a life threatening injury. And then our defendant, Dr. Deal, requested some tests be done. And Dr. Deal, a surgeon with staff privileges who believed Kearney would not survive a move to another hospital, carried out emergency surgery, which took 9 to 10 hours to complete and was finished the next morning. In following the procedure, Dr. Deal issued numerous oral and written directives on Kearney's post-operative care, and according to Dr. Deal, one such directive was verbally issued to a nurse and stated that plans needed to be made for a medevac by midday, or other words, a transfer, but Kearney wasn't relocated until after 5 o'clock. And then when Kearney first arrived, his condition was so bad that Dr. Marburger, the doctor to whom Kearney was transferred to, thought Kearney would soon pass away, and on September 18th, Kearney endured the first of a series of amputations under the direction of Dr. Marburger, who also performed vascular surgery. And Mr. Kearney's left leg actually, was eventually amputated at the knee, while his right leg was eventually amputated at the hip. Dr. Deal claimed that he was exempt from any culpability for his own activities under the Alaska statute, sometimes known as the Good Samaritan statute. And then this case was brought to court, and the trial court had it right when it ruled that AS 0965, the Alaska Good Samaritan statute, applied. Physicians who already have a duty to provide emergency cares are not granted immunity under Section 090A, which Dr. Deal had. Dr. Deal had a duty to provide emergency care, so he is not granted immunity under Section 090A. Also, the Good Samaritan statute is a safeguard, not an immunity, so I concur with the court. If I'm not mistaken, Dr. Deal issued improper oral and written orders in the name of being a good Samaritan during an emergency. But in reality, he wasn't being a good Samaritan if he allowed someone to deteriorate and not have the necessary operation. He neglected a patient as a result of improperly performing his prior obligations. Hence, the Good Samaritan Act does not apply in this case. Now, moving on to legal implications. And for physicians who do get this Good Samaritan statute applied, physicians are exempt from civil damages without being fined, sued, or arrested for their actions under the statute, with the exception of any charges of gross negligence, although they are not protected from negligence accusations or trials.